I'm Danella Eliasov. I'm a psychiatrist in private practice at Park Lane Clinic. My interest is mostly in adolescents and young adults. I also have an interest in neuropsychiatry, and I have a background in sports medicine, so an interest in sort of the fusion between psychiatry and sports medicine. So today I'm going to be talking about mood disorders, just in terms of an outline of what I plan to talk about. So to begin with, just to introduce the talk, we're going to define mood disorders, talk a bit about the diagnosis, the treatment, go through some controversies, because in psychiatry and psychology there's always controversies, and then just wrap it up with a conclusion. So by way of introduction, what I sort of first have to say is what Socrates said, which is that true wisdom is knowing you know nothing. And I think that that's quite an important thing to bear in mind throughout this talk, is that we know so little about the brain, even though we've learned so much over the years, and psychiatry's grown from the days of the asylums, of insulin comas and things like that, to sort of what we have now, where we really understand the brain a lot better. However, there's more to a person than, I suppose, just neurophysiology, and we're still learning about the brain. So this is going to be just maybe some interesting points and things that I've learned in practice. I know that this presentation is going to be sort of distributed to a wider audience, including parents, teachers, psychologists, various healthcare professionals. And I think it's just important to bear in mind something called the Dunning-Kruger effect, where pretty much what that is telling us is that people who know the least tend to be the most confident, and a little bit of knowledge can actually be quite dangerous. So I just need to say that this talk is not a comprehensive explanation or discussion of mood disorders. It's just some ideas and some things to discuss, but that it's always best to refer to a healthcare professional in whose scope of practice it would fall to diagnose and to treat a mood disorder. So in terms of definitions of mood disorders, the way we as psychiatrists and in healthcare, we define a disorder according to DSM criteria, so the Diagnostics and Statistics Manual, and also ICD. It's another way that we can code. I'm not going to go through kind of every mood disorder that there is and all the definitions, because I think that's, some of us have heard it a million times. But just to sort of focus on some core essential features how we define a mood disorder. So what stops you from just having a mood versus having an actual disorder? Where does that line get drawn? And dysfunction is sort of, if I had to use a key word, it's dysfunction of the brain. So it's not just in your head, or it's not just, pull yourself together, I'm just a bit sad today, I'm a bit stressed. It's actually brain dysfunction. So when we talk of a mood disorder, we are not talking about a sad person. When we talk about depression, we're talking about a person whose brain is not working normally. And that's that can be a difference between all of us get sad, but those of us with depression, our brains are not working correctly. The other definition that will appear in DSM, and that's very important when I suppose decide if a sad person is depressed or just sad, is dysfunction. So dysfunction in areas of your life, social and occupational, and in kids it would be academic. So perhaps the person is struggling to connect with others, relate to others, they're struggling at school, they're struggling at work. That sort of then would mean that they meet the criteria for what we call a disorder, as opposed to just a normal mood fluctuation. It's also important to remember all mood disorders are a cluster of symptoms. So it's not just a mood, sad, happy, angry. There's usually associated features, so it forms almost like a cluster of syndrome, and with syndrome and things like sleep, appetite, cognition, which is memory, concentration, our ability to think,